different aspect where it has affected both adolescents and the young people, including, talking about the logistic supply and distribution of sexual and reproductive health products, precisely things that had to do with menstrual pad and a whole lot of things. Of recent, I even understand that the prices of those things are jacked up in some countries where they're having low production, low resource setting countries and all that. And even right now, nobody buys menstrual products in Scotland. It's now declared free. The government to be supplying everyone. So I'm looking at what you said and how that I just begin to think that there may be, for people that cannot afford it in countries where they're having low resource problems, there might be this psychological impact. So I was beginning to think that bringing up case of psychological implication of the effect of COVID on the supply chain in for vulnerable population might be a fantastic thing.
I think like in terms of sharing the experience from the UK, what we've actually seen is a really effective rollout of telemedical access to abortion. So a system whereby women who want to access early medical abortion, so that's abortion with a pill, are able to contact the clinic remotely and then receive the pill by post. They're screened during that consultation so that if they are vulnerable women or if they have certain contraindications, then they are taken in to the clinic to be seen and assessed by a doctor. But what has been found is that not only has it reduced waiting times, but it's actually reduced the average length of gestation at the time of abortion, we think by around a week. So it's been hugely beneficial to equity of access to abortion in the UK. And I would be really interested to hear people's opinions about the potential applicability of that to other countries, especially countries where equity is more of an issue.
It's a beautiful idea because I came across that of late, and I was just thinking how that's gonna be, how that's gonna be rolled out in places where abortion services just been they're looking at abortion services recently. Of course, in many countries like Africa and some other, especially places where I came up from, abortion service is one. It's not being encouraged unless it's threatening to the life of the mother, and to a good extent, abortion service is not being treated with equity.